good afternoon, everyone. I'm Carla Gibson, Vice President of Programs at the Reach Healthcare Foundation. The Reach Healthcare Foundation is a charitable foundation dedicated to improving health coverage and access to quality, affordable health care for uninsured and medically underserved people. The foundation focuses its support in a 6-county service area that encompasses Allen County, Johnson County, and Wyandotte counties in Kansas, and Cass, Jackson, and Lafayette counties in Missouri. REACH uses a community investment framework centered on 3 outcome areas that support the foundation's aim of achieving equitable health outcomes. Each outcome area is further defined through strategies that drive our work, partnerships, and where we invest. And those areas are bridge the coverage divide, close the health equity gap, and strengthen the safety net. So those are our focus, our priority investment areas that we focus our funding in. We have about $150 million in assets. We have funded 2,300 plus grants since our inception, which was in 2005. We have awarded over 88 million, and we have a board of directors that represents our service area, including our rural areas, of 17. That's who we answer to. And I'm looking forward to diving into the questions so you can learn more about the foundation world. And I'll turn it over to my colleague now, Cale, who can tell you a little bit more about Health Forward.
I think we lost him momentarily, so hopefully he's able to pop right back on.
Well, we can keep talking. Did you want to do questions or?
Sure. I'll just go ahead and ask about kind of the original creation. My general understanding is that your organizations are loosely based as far as like origin on the same sort of principles. Can you tell me a little bit about where at least your organization or both organizations came from?
Yes, I can tell you a little bit. So both foundations were formed out of the sale of a for-profit hospital system. They formed one on the Kansas side and one on the Missouri side. And I think initially the plan was for REACH, we're based in Overland Park, Kansas, was for REACH to invest in Kansas and for Health Forward to invest in Missouri. But through the litigation and all of the subsequent lawsuits that happened, we have the exact same service area. They got 80% of the proceeds, so they're much bigger than REACH, and we got 20% of the proceeds. We consider Health Forward, we call them our sister foundation. And so we were born out of the same sale, and we do a lot of work in partnership together. So I think Cale's back now, so I will turn it over to him.
Yeah, sorry about that. I'm at the library here in Jefferson City, and I was having no problem with the connection until, we started on Zoom. Not surprising how that sometimes goes. Can everyone hear me okay?
Yeah,
Okay.
You sound great.
My name is Cale Martin. I'm an impact strategist at the Health Forward Foundation in Kansas City, Missouri. I've been at Health Forward a little under 2 years, and I'm on the people team, which I'll get into a little bit more. But yeah, as Carla mentioned, REACH and Health Forward have the same origin story, work closely together. I think 2025 is our 20th anniversary, both Health Forward and REACH, if I'm not mistaken. Health Forward has invested around $400 million to our geographic community areas since that time. In November of 2018, Health Forward changed its name from Healthcare Foundation of Greater Kansas City and rebranded to the Health Forward Foundation. And then in 2022, we announced a 5-year purpose plan that really recasted our leadership, advocacy, and resources to promote health equity.
So, could you share a little bit more about your foundation's core missions, and how specifically you might envision how they could support rural healthcare initiatives in Missouri?
Do you want me to go, Kale?
Sure, if you want to start us off, we can kind of
Um,
ping pong it if you like.
Yeah. So, our mission is to advance health equity through coverage and care for underserved people in our region. And we are mandated how we were set up to invest in our three rural communities. So it's not just, oh, let's go help rural people. We have a mandate to um, to put our funds in back out into the rural communities that are in our service area. Um, I think that how we do that has changed over the years. You know, I've been with the foundation a lot longer than Kale's been with Health Forward. So I've been a part of our evolution. But early on, when I started, you know, it we put out our big RFPs. We said, everyone come apply from our service area and get and compete for this money. And what we saw was that we were not doing a good job in investing in our rural communities, which we are required to do. And so I think what we learned early on is that we must invest differently in our rural communities. And what that means is we need to be in community with our rural partners. We need uh, to I don't know if you all have heard this term, trust-based philanthropy.
Mhm.
It's all over the place. But I say we began practicing that before it even was a thing in our rural communities. We began to see that that the investments must come from the rural partners. They need to tell us what they need, and we need to be responsive to the needs because they know best. And so we totally changed our view of how we do that, and we have really grown in our investments with our rural partners. And it's just been a true pleasure to see that happen over the years. So I'll let Kale talk about his answer.
Yeah, thank you. And I think a lot of our answers will be very similar. At Health Forward, our purpose is every day we work to support and build inclusive, powerful, and healthy communities characterized by racial equity and economically just systems. Our commitment to change prioritize efforts to improve the lives of people who experience the greatest injustice in health outcomes. And we do that through our community of focus. And so our community of focus spans those geographical areas on both the Kansas and Missouri side that Carla has alluded to. Maybe this had already been mentioned, but it on the Missouri side, it's Jackson County, which is predominantly Kansas City, Missouri, Cass County, which is just south, and then Lafayette County, which is just east. So Lafayette County is very rural. Cass is suburban and rural. The county seat is Harrisonville, Missouri. And then aside from our geographic community of focus, we're really we're really being really intentional around people of color whose outcomes are shaped by structural racism and other socioeconomic conditions. And of course, people in rural areas where there are many systemic barriers that hinder optimal health. So we know these communities often overlap, and experience economic insecurity, maybe living in marginalized conditions, but really trying to find innovative ways to ensure that everyone has access to high quality care that is affordable.
Thank you both very much. So, pivoting just a little bit, what are some issues that your foundations are prioritizing in your funding strategies at this time?
Carla, you want me to go first on this
Yeah,
one?
go ahead.
Okay. Um, I'll try to keep it as high level as possible and not get too much into the details. But we have at Health Forward what we call our 4 purpose areas. So people, place, power, and platform. The people team, it really supports your traditional direct care providers. So think your safety clinics, community health centers, other community-based organizations that might do mental health support, other social supports. And we're really focused on whole person care. So that could be the range of services, physical, behavioral, oral health, social services, but also doing that in an inclusive and culturally responsive way. I'm a part of the people team. We have particular strategies that we are working closely with funded partners to advance health equity. And so we're working with a lot of our partners on the utilization of community health workers, some food as medicine initiatives. So when we say food as medicine, we're referring to medically tailored meals, medically tailored groceries, produce prescriptions, really those nutrition interventions. Um, and then also looking at the healthcare workforce, diversifying the healthcare workforce, making it more representative of the communities that they serve, and then also looking at race, ethnicity, and language data. Our place team is really focused on affordable housing and home ownership as a means to building wealth. And they're also doing a lot around digital access and other digital opportunities. Our power team is really focused on capacity building. So working with smaller grassroots organizations, and then doing a lot around civic engagement as well. So think voter registration and things of that nature. Our platform team is looking at narrative change. And so often how healthy we are is strongly influenced by even the stories of our communities. So thinking often about the narrative of rural communities, there's varying narratives out there. Some positive, some not so positive. Maybe some that are fair and maybe unfair or unrealistic. And so, thinking about rural communities, how can we really raise those rural voices and stories about resilience and a lot of the innovative and resourceful things that our rural communities are doing to address particular challenges and really speak to the assets in rural communities. And so lastly, policy is something that's really interwoven in all of our work. We don't consider it its own purpose area, but we're working across the board and in terms of tracking different legislation on the state and local level, and really working closely with our partners that are interested, in different advocacy initiatives. Carla?
So first and foremost, I would encourage you all, I know we're throwing a lot of information at you right now, but to find out kind of what we're investing in, go to our website, www.reachhealth.org. And there is a document on there called our Community Investment Framework. And that document is how we operationalize our strategic plan, the plan that the board has set forth for us to implement their wishes is laid out in that community investment framework. I will just pull out a few things that might be of interest to you that we are prioritizing. One is rural innovation. We want to constantly encourage our rural partners to think outside the box on how to address healthcare disparities and issues in their own communities. So we specifically allot funds around what we call rural innovation. And that's where the solutions definitely come from the community. If they are aligned, we're able to support that. But we want to encourage innovation. So for example, transportation, we're a health funder, right? But we have one of our counties is actively solving their transportation issue themselves and has a transportation service that gets people to their medical appointments, but also gets them to Walmart and gets them to their hair appointments and other things. we are supporting that organization, even though we are a health funder. It's very important because we know transportation is a social determinant of health, that we fund them under rural innovation. The other thing we're very focused on is building the capacity of our local public health departments in our rural communities. We know that COVID decimated those health departments. They were overworked, their leadership turned over, they were worn out. It was very hard for them. And coming out of COVID, it was clear that they lacked capacity to address the pandemic, but even worse, coming out of it. And so in our three rural health departments, what we do, we have worked with them on building their capacity, and one also providing them with unrestricted core support, and building partnership with them to address some of their other needs. So that's very, very important to us. Other things that we're focused on, we are focused on increasing core support to our partners. We know that folks are tired of being pushed into programming, and that what they really need is money to keep the lights on. What they really need is money to, pay the admin assistant or whatever. And so we are really trying to unrestrict as many dollars of ours as we can and deploy it out into the community that way. We are very interested in also in capacity building. We know that if you don't have strong organizations, you can't do the work out in the community. And organizations tend to, they apply to us for programs all the time, but really, how do we ensure that the organization is strong from the inside out so that you can do all the great work that you do? And so we are very, I think we're very savvy and skilled at finding just the right balance in terms of capacity building with our partners to address those non-sexy things, like audits for an organization, covering the cost of that, that aren't so sexy, but they're much needed for the internal infrastructure. We are also, as Kel said about his organization, we have a significant investment in what we call care connectors. It's those positions that link consumers to healthcare services and ensure that they are enrolled in any public benefit, the marketplace or TANF or whatever that they are eligible for. And those positions are usually from the communities that they serve. And that has been a long-term investment of ours, and one that we continue to remain committed to. And then the other one there's other ones, but the other one I'll touch on is advocacy. We worked to help get Medicaid expansion passed and implemented on the Missouri side. We're still working to try to get it passed on the Kansas side. We support civic engagement. We support lots of issues that our partners are like 340B and all of those issues that you all are concerned about. We are supporting work around, but advocacy is a big part of our investment portfolio.
That's great. Thank you both. I don't want to take up all the oxygen in the room. So before I ask you about some success stories, I wanted to see if there are any questions from the audience. Feel free, like I said, to pop those in the chat or, even raise your hand and come off camera. So would you be willing to share a success story of an organization that's benefited from your funding?
Do you want me to go first?
Yeah, I can start. Yeah, sure, Carla, if you want. We can just try to go back and forth.
You go ahead.
You want me to go ahead? Okay. Thank you very much. There's a couple that come to mind. Altruism Media in Lexington, Missouri, which is Lafayette County. Tanya Wright has a maternal health center that provides prenatal and postpartum support for expectant mothers. And so this support often includes mental health care, nutrition support, and they use community health workers as well as doulas and midwives. So as many of you know, and that's similar to the case in Lexington, there's just a lack of access for those types of resources. And often expected mothers have to travel 45 minutes or more, up to an hour for their appointments, certainly for delivery. And so to be able to have just one additional option within Lexington and the surrounding area where folks can come and not only work on their maternal health, but they have access to additional resources there as well. So the CHWs are connected to a food as medicine pilot program. There's also supports like food, diaper, clothing, car seats, etc. And so it really has become a hub for expectant mothers to not only get that care, but if there's additional resources that they're needing. Welcome Wellness in Cass County. Janine has done a phenomenal job in a really short amount of time. Welcome Wellness, I think, started really just a few years ago. Predominantly serves Cass County, which I mentioned was in South Kansas City. So it's suburban, but also very rural. And there's a lot of rural residents that travel to her. She's in Belton, Missouri. And so being that it was relatively new organization, Janine focused predominantly on healthy lifestyle classes, maybe some diabetes education, a lot of health promotion. But since that time and being able to closely partner with her, she has gotten some of her staff certified as a community health worker. She recently attended an advocacy day with us last month in Jefferson City, where she was able to really speak with legislators, not only on maybe how different funding challenges or this funding climate is affecting her as an organization, but how there's a lot of challenges that her community and clientele face. And so there's a couple different ways in which we were able to partner with her just to give her the opportunity to really advocate and provide a platform, not only for the work that she does, but to really speak to some of those real issues that a lot of her clientele face.
So remember early on, I talked to you about our not doing too well in investing in our rural communities. We launched what we call was a rural health initiative, and that was aimed at increasing our investment and partnership. It was a multi-year, large dollar investment in our rural communities, and that was the first time that we actually said, "What do you need?" And ever since then, that was our kind of pivoting point. So out of that initiative came some really great things. One, we totally did increase our partnership and our investment in two of our rural counties, Lafayette and Allen. And those counties in Lafayette, the work of the Rural Health Initiative brought new people to the table because we often saw that we were getting the same people. It's the business people, the people that have a little bit more prominence in the community. We're always the ones at the table and making the decisions for, the county. And so it helped us to increase the partners that were working with us and increase our investment in it. In Lafayette County, it led to actually the development of their federally qualified health center. They didn't have one. And through that work, the Live Well clinics, which is their FQHC, emerged out of that all the stakeholders meeting and all of that. They now have an FQHC in Lafayette County, a large one with multi-sites, but the Rural Health Initiative seeded that. So I'm very proud of that. And then, although the Rural Health Initiative has been over for a number of years, what is still happening in Allen County is that they still meet. They call their group the Rural Health initiative, and they still meet. So they have a cross sector of people that are still meeting and coming together and adding new people to the table to address their own issues. And so we seeded that, but to this day, it still continues. So whenever I see sustainability like that, that's a great success story. Now, we didn't do too well in Cass County. It never took off. However, since the Rural Health Initiative ended, what has happened is good old legwork. We started meeting, we started going into the community, we started asking who should we be partnering with. And I am extremely proud to say that we have really increased our funding in Cass County through good old-fashioned relationships. And some of the ones there are groups that, once again, we had to think we can't fund the same way that we do in our urban communities. But so we've really thought outside the box, and we really have been able to grow the number of partners and the amount of funds that we put in that county over, I would say, the last 5 years. And once again, that was a personal mission of mine to do. And I'm extremely proud that we now partner with 2 organizations in Archie, Missouri, which, is a little tiny town, in Missouri. All the school district, the health department, the mental health center, we have a great portfolio there now that didn't exist and wouldn't have existed if we hadn't have gotten outside of our office and went into community and built those relationships. So that's kind of what I'm most proud of for us.
Can you speak to any projects that you've done focused on rural workforce development?
I'll go first. Workforce is not it's not one of our key strategies. We don't while we have funded workforce projects, it's not one of our it's not in our community investment framework. So I know Kel, they have a big focus on workforce, so I'm gonna let you take that one.
Yeah, thank you. So we are just now wrapping up roughly an 18-month assessment, a landscape assessment, to really learn the gaps and opportunities and even the assets within our region. So we partnered with NORC at the University of Chicago to conduct the assessment. So there's an executive steering committee that meets roughly on a quarterly basis. There's a community advisory board that meets monthly. There were key informant interviews and listening sessions. And it was really a diverse group across different industries, but we had a lot of strong rural representation as a part of this landscape assessment. And we're just now really combing over the findings and plan to present that here in the next couple of weeks to our executive steering and community advisory board. The assessment was really led by community. And so not only was it informed and guided by the community, the assessment is really for the community to digest and hopefully serve as a resource, but it really guides Health Forward in how we're going to approach the healthcare workforce in the coming years. We know that a more representative healthcare workforce simply leads to better patient outcomes. And healthcare is such a large economic driver, particularly in rural communities. And so talking with a lot of our rural partners, they've come up with a lot of innovative strategies. Carla had mentioned HCC, even some of our federally qualified health centers, even on the Kansas side, they have these grow your own programs, and they understand you have to get exposure even maybe to some 4th graders. Mm-hmm. And so it's really neat talking to our rural partners of how they're having elementary and middle school age students come to their clinics, come to their hospital, have a theme similar to, hospitals like a city. It's more than just a doctor and a nurse. There's a lot of different opportunities out there. Right now, we're working with some of our community health centers on financial assistance um, and other tuition assistance for those that are physicians, perhaps that are serving in an underserved area, looking to do career laddering as part of nurses. So perhaps they might have started as a certified nursing assistant, but are interested in now getting their LPN and then, gradually into an RN. What kind of support, what kind of resources and wraparound services are needed to really not only promote and encourage, but really support that pathway?
Right. Rachel, I do have one example of a workforce investment. So once again, we're relatively small and workforce is huge and it's going to take a lot of money. It's going to take a lot of people to address that. But one of the ways that we saw a role for us is kept hearing burnout, with our workforce coming out of COVID, everyone's burnout and tired and, worn out. So one of the things that we did were what we call wellness grants. So we opened up an RFP for wellness grants and we said, apply. And this is open to our rural communities as well, everyone in our 6-county service area. And it was really to address retention and the wellness of current workforce. And we asked them to tell us how they want to do that. We said you can apply for up to $5,000 and you tell us what you want to do. Think outside the box. We don't know how to keep your workforce happy. We don't know what you need, but you tell us. And those grants were hugely successful. And we awarded a number of them to our rural partners, in the health departments, in the HCCC, who's on here, they received one. And it was really for things that they could not pay for otherwise out of their budgets, like a trip to a museum for all staff, or having a holiday party, or going out to lunch. It was those kind of things that you don't typically see funders fund. And it was because we asked them, what do you need to make your staff happy and to help you retain and show you appreciate your workforce that you have? And so those were very, very well received. So that was one way we funded some workforce stuff.
Yeah, and Carla, you bring up such a good point because that's something that we hear across the healthcare professions, and particularly after COVID, was just the mental health well-being of the current workforce. And you saw a great exit post-COVID, and there was already really troubling projections forecasting what the healthcare workforce will be in the future before COVID even affected that. I will also say that we have a partnership with Missouri Primary Care Association. We had gifted them $1 million over the next 2 years for financial assistance and tuition reimbursement. They already work very closely with the federally qualified health centers around the state and have a similar tuition assistance program. These funds will let them be not as restricted to which healthcare professions, but really be able to tailor it to the community health centers within our geographic region based on their needs. And so we were able to convene both Missouri Primary Care Association, but also the executive leadership of the Kansas City region's community health centers to really discuss, okay, what are some of those recruitment and retention opportunities right now? We know that there are some resources currently available, but once that time commitment is lapsed, once that physician, for example, works 2 to 3 years at that particular community health center, they often will leave for another opportunity. How can we work together to find innovative ways to not only recruit more staff, but also retain, the folks that are currently there? So we are learning a lot through our assessment, and we'll be finding additional opportunities moving forward. But even right now, we're still heavily invested on some of healthcare workforce issues.
Thank you. Okay, another question from the audience. You all do so much work and with so many different kinds of partners. How do you keep track of your accomplishments and current or completed projects?
Um, that, I mean, that's our job. Um, really, we are stewards of the money that that is within our foundations, and we have to report to our board. So our board governs all of that, and so what you all do rolls up to the board. We have to report to them. But I would say more kind of ticky tacky. We have a grants management system where we and a grants manager person who tracks the grants throughout the process. The program officer, that's their job, is to monitor and make sure that the grants are going, and mine as well. That I maintain a portfolio as well. And we also we have a process. We do site visits for our for most grants, and so we go out and we visit with our partners. We're also out in community, and we're involved in a lot of the projects that we fund as staff. So we know how they're going, and we're a part of the work. That's a big part of what we do. So I would say that through the process we have set up, grants management system, the program officer position, and then just managing your portfolio is how we we make sure that things get done and stay on track. Now, Health Forward has a lot more staff than we do, so I'll let Kale talk about that monster over there.
Yeah, I mean, everything that Carla says really applies to Health Forward, and it is a challenge because we're seeking systemic change. And so, how do you measure systemic change? We have a really strong learning and evaluation team where we're trying to find different indicators and find ways to be able to measure that. But it is a challenge. But similar to what Carla said, I mean, we have really leaned into trust-based philanthropy. We have really found different ways for organizations to report impact back to us and to share that impact, whether it's qualitative or quantitative. We have really transitioned away from maybe a formal reporting style where there's kind of compliance based and there's all these different metrics that an organization had to report on, or else there might be graded in a certain way or perceived in a different way for future funding. It really is relational. It's up to I think Reach refers to them as program officers. At Health Forward, we call them impact strategists, to really build that strong partnership and relationship with that community organization, with the community that they serve. And that is also where we get a lot of our feedback. We get a lot of our learning is through those relationships.
One of the things we moved away from, once again, I've been in this game a long time, and we've tried everything to roll up outcomes to measure our impact of what we do as a foundation. And so I think we've moved more toward imposing outcomes on people. And what we ask now is like, what does success look like for you as a grantee? And you tell us, and then we'll hold you to it. But we can't give everyone the same outcomes, and we can't, we tried that across the board. Let's have everybody convene and come up with three, and that just didn't work. So we're we asked, what does that mean for you all as an organization? Now we have dashboards and all of that internally that we report to the board, but we try to take the burden off of you got to do the work. Grantees got to do the work. You don't need to be trying to track a bunch of data and 400 million things and do the work. But just tell us what it means for you, how you're going to measure it. And if we agree upon that for the grant, then that's what it is.
So, could you share any advice that you might have for a rural health organization that's maybe new to foundation funding, and what they might be able to do to what factors might make their application stand out?
Good question.
You want to go first, Kiel?
Yeah, I can take a stab at it. We have largely done away with a formal application process. We call it a basic application. And so it's meant to be, simplified and not require as much capacity and energy for that grantee. Like Carla was saying, we don't want to overburden the applicant or the funded partner. Some organizations even have to contract specifically just for grant writing, right? And it takes a lot of time to be able to not only pull those together, but from the funder's perspective, you're only getting so much from just reading the report. It really comes from that relationship and getting to know that organization. So even though we have a basic application process, it is really in the name. It is really basic, probably 5 or 6 questions to talk more about purpose alignment, project overview, what are your objectives and goals. And so for us as a funder, we hope to have a lot of those conversations often in place. Now, we have different types of funding opportunities. We'll still have more competitive processes. We'll have some invitation based, but many of our purpose areas at Health Forward are looking at, hey, let's not have a partner even go through the application process until we have kind of established that relationship and really get a better sense of some of the strategies and objectives that they're working towards. I'd say one other thing that Health Forward has tried to do is if there are maybe some financial flags from an organization, that actually is an opportunity to engage them if there's a alignment, and see if there's ways that maybe we can connect them with a fiscal sponsor, if there's other capacity building tools that might be appropriate and useful for them. And so it really is trying to build that relationship with the organization outside of just what they put on paper and present as an application.
So for us, it is all about the relationship. It's our job to help you get our money. And so what I would encourage you to do is to reach out to the staff members of a found. Well, one, I always encourage people to make sure you do a preliminary look at the website, see if you feel like you're eligible. For you're aligned and you're eligible. And then if you feel you are, then reach out. We're people too. We are from community. Our president and CEO is from rural Kansas. I mean, it's not like we're these figures that sit in our ivory tower and just pass out money. We are very approachable. We can't do our job without you. And so it would be really important just to reach out and set up a meeting or send an email and ask a question. We're very responsive. We're small, so we can be nimble, we can be quick, and can really point you in the right direction. Like, okay, this organization wants this, and maybe should go this way or this way. That's our job. Let us take that on. But start it with building that relationship with a foundation staff member if you feel that you are aligned with what they're doing. And I would say, that's for any, for Health Forward, for Missouri Foundation for Health, all of the foundations that are out there, really just, reach out and schedule an informational meeting. Would be a good way to start and to not be afraid. I mean, once again, we need you. You need our money, but we need you to move our mission forward. And I think sometimes grantees don't realize that. And so we are not the holders of all this money. We got to get it out into the community, and we can only fund 501c3s and semi-governmental entities. So that means we need organizations to advance our mission. So that would be my advice, is to not be afraid and to reach and ask for what you want. We can only say no, right? And ask for the full what you want, and then it's our job to kind of align it and narrow it down. So if what you need is this, then make your ask for that. But I think working with a staff person can really help you to do that.
Yeah, and I would just piggyback on that, and thank you, Heidi, for sharing Health Forward's link to our website. On the website, there's a place where you can request a consult. Those are usually 30 to 45 minutes. But I could say that many at Health Forward really enjoy that process because it's an opportunity for us to get to know new organizations, get a better understanding of the communities that you all serve. And it really goes into, even if maybe there's just at this moment not direct alignment in terms of some of our funding priorities, it really does a lot to help us learn around the healthcare ecosystem and get a deeper understanding of a lot of those issues.
A question in the chat: have you done funding for healthcare career exploration at elementary or high schools?
Um, recently, not elementary so much. We have put some funding to a high school for it's called an anatomage, and so it is a digital table that is really complex and in depth, where students can utilize the touch screen and look at all different parts of the body, nervous system. You can drill in and look at the different parts of the cell. It's really fascinating, all the different ways to do it. We have worked some with like medical students, and others that are in healthcare professions, but perhaps they're in community college or college, around building mentorship and social capacity. That is one thing that we hear a lot from our partners, but also through that healthcare assessment that we're conducting, is that it really starts at an early age. And so that's certainly something that we understand is important and are considering.
Yeah, we've done a few projects, and most recently, we've partnered with Kansas HOSA. I don't know if any of you are familiar with them, but it's a career technical student organization that supports middle school through college and beyond for those interested in healthcare careers. That's a new partnership for us, and we are supporting their two leadership conferences. We have also funded some a project, I See Stars, which is urban, and that works with urban youth to in terms of not just it's technical IT, but also IT in healthcare careers. And then in the Kansas school district, once this is not grade school, once again, this is more high school focused. We developed, they have a workforce guide that is a healthcare workforce guide that they had developed, but they needed it to be digital and dynamic. It was a hard copy. And so we funded digitalization of it, and we're able to make it more dynamic, so you can click on this guide. It's actually and translate it into Spanish. So that was another way that we supported kind of high school level, but I think anyone could probably use that guide in terms of healthcare careers. So those are kind of a few of our investments, but those came from community. People came to us and said, this is what we do. Are you interested in supporting it? And we've really worked with all of those that I talked about to align them with Reach and be able to fund them. But those are some very specific examples of how we done that.
Mhm.
And I would just add, the Mission Vision Project in Kansas City, they work closely with medical students, residents, but even physicians of color to really build community and act as mentors and really build that social capacity. But they have increasingly done more high school outreach because often you think doctor and nurse, right? But really being able to then connect those high school students with a mentor or just with someone that may have a similar lived experience, perhaps face similar challenges, or at least similar experiences along that career pathway. And so we found that has been really successful, just be able to connect with someone that you trust, that shares a lot of different similarities, just to be able to bounce ideas and questions off of, and being able to do that, of course, before you exit high school, really opens up for additional opportunities.
That's great. So we just have a few more minutes. So I'm going to throw one more question and then we'll see if there's any other from the audience. But basically, beyond grants, how could our organizations engage with your foundations? And what's the best way to stay in touch?
I think we've alluded to that. You know, we beyond funding, we also offer like technical assistance. We offer our self convenings and opportunities to for professional development, stuff like that. And I would say sign up for our newsletters, because that's typically where we will say, "Oh, we're having a workshop for anyone to attend on sensitive data." I'm making that up. So sign up for the newsletters. On our website, there's a way to get in touch with me, or a way to get in touch with a program officer, or anyone else, and that's www.reachhealth.org, to ask any questions. I would say that it's not always about just a funding relationship. We offer thought partnership. We can serve on boards. We can, matter of fact, MRHA, I'm on the board of MRHA. So we can leadership, we can convene people, we can learning. We always offer learning opportunities, and we put out reports that are free for you all to use in your grant writing or in developing your programs. There's lots of resources that come out of the foundation beyond just grant making, because I know many of you probably aren't eligible for our funding. We have a small service area, but there's other resources that you can get from a foundation, that don't always have to be a check.
Yeah, I would echo similar. We will do webinars and even some summits around different area topics such as food as medicine. Just last week, we had a webinar around advocacy training where we partnered with Boulder Advocacy Group, that was really targeting nonprofits that are maybe interested in conducting advocacy or growing advocacy. Our policy team has created a policy toolkit, and I believe next Wednesday, they're going to have a webinar to really kind of comb over and summarize all the different aspects of that policy toolkit. So that could be templates on oral and written testimony. We've also created several different policy briefs. We have a rural health policy brief that I think will be announced and socialized here very soon. There's also one on community health workforce. And so there's a lot of different ways that we can provide tools and resources, even if you're not particularly in our geographic area or are a funded partner.
That's great. Thank you. If you would be willing to drop your contact information in the chat, we'd love to have that. Are there any final thoughts or anything else that you'd like to leave us with?
I would just like to say thank all of you for all that you do. I've been worked on the other side as well for many years, and I know it's not easy, especially right now, with a lot of uncertainty going on. And I thank you for what you do to serve your community, and also for sitting in and listening to Kayla and I today. We appreciate you attending.
Yeah, likewise. Thank you, everyone, for everything you do. Know that this is a challenging time, probably for many of you. And thank you, Missouri Rural Health Association, for the invitation. Carla, it was a pleasure connecting with you. I'm trying to text my contact information in the chat. So if anyone is interested, please don't hesitate to follow up with me afterwards.